Добрый день.
Good day, everyone. As you know, there are also dangerous animals in Crimea, poisonous snakes and insects that carry infectious diseases. But this is not a reason not to travel outside the city, is it? Of course not. You just need to be aware of them and how to behave carefully. And today, we will also talk about food safety, about poisoning with heavy metals and agrochemicals, and of course, about basic principles of a full-fledged diet that promotes good health. Thank you and take care of yourself.
Берегите себя.
While studying in Crimea, students should know what dangers they can expect outside the city. The largest predator that can be found in Crimea is a wolf. Wolf attacks on humans in Crimea are rare. There are 1 to 2, maximum 3 attacks per year. Most often, wolves attack single tourists, women or children in the forest. If you've seen a wolf from afar, it is best to leave the territory. You can't look a wolf in the eye or turn your back on him. This can provoke an attack. If you are attacked and bitten by a wolf, it is necessary to consult the doctor to get an emergency vaccination against rabies. Wild boars attack people much more often in Crimean forests. In Crimea, wild boars grow up to 1 meter in height. The boar's body length can be up to 175 centimeters, weight about 100 kilograms, and sometimes more. The boar is not a predator. Usually, a boar attack on a person is an attempt to protect the offspring, called piglets. If a person gets too close to the boar family, the person can be attacked. Most often, wild boars attack tourists who want to take pictures with little piglets. This, of course, leads to serious injuries. If you see a boar from afar, do not approach it. When a boar attacks, the best tactic is to climb a tree and wait until the animal leaves. In Crimea, there is only one poisonous snake, the viper. It can be recognized by the characteristic pattern along the trunk. The Crimean steppe viper is small, no more than 1 meter in length. Vipers live in burrows of other animals, in rotten stumps, in bushes. If you see a viper, do not panic and do not show aggression. The snake viper is not aggressive. Sensing your approach, the snake itself will try to crawl away as far as possible. To avoid being bitten, it is enough just not to touch it. The viper bites only for the purpose of self-defense, when a person accidentally steps on it, or sits on it, or picks it up. If a viper has bitten you, do not panic. The poison is not fatal, and a full recovery of a person will occur 2 to 3 weeks after the bite. After the bite, try to move less, because muscle contractions will increase the rate of venom absorption. It is urgently necessary to take antihistamines and painkillers to wash them down with plenty of water. For further treatment, you need to contact the nearest hospital. Viper venom reduces blood clotting, increases vascular permeability, and causes severe damage to the skin and muscles around the bite. A necrotic ulcer forms at the site of the bite. Edema appears. Lymphatic vessels and lymph nodes become inflamed. There are symptoms of poisoning such as nausea, vomiting, and headaches. If a large amount of poison enters the body, nasal and gastrointestinal bleeding may occur. To prevent the snake from biting you, you need to wear closed shoes in the forest, preferably boots. Trousers or jeans should be made of dense fabric. If you are picking mushrooms or berries, push the grass in front of you with a long stick and not with your hand. Paraquat poses a serious danger in human health. The spider is not aggressive and can bite only if you step on it or pick it up. Paraquat venom is a neurotoxin. It blocks the transmission of nerve impulses in the synapse. After the bite, the victim begins to have painful muscle cramps. Later, the poison of the paraquat can cause paralysis of the muscles, including the respiratory muscles, which lead to death. Symptoms of poisoning appear after 10 to 15 minutes. Severe pain throughout the body, restless behavior, fear of death, chills, thirst, visual hallucinations, excessive sweating, lacrimation, nausea, vomiting, fever, tremor and muscle twitching, shortness of breath, bronchospasm, increased and later decreased blood pressure, heart rhythm disturbances, urinary retention. First aid for the paraquat bite is to call an ambulance service. Put cold on the site of the bite so that the poison enters the body more slowly. Before the arrival of specialists, it is necessary to immobilize the bitten limb. Muscle movement accelerates the absorption of poison. Precautions in nature. Do not leave your shoes unattended. A spider can get into it, and do not walk barefoot. Use repellents. Tarantula venom is not dangerous for humans, but in the place of the bite, in the human skin, foreign bodies may remain. Small spider hairs, for example. They act on the human body as strong allergens, causing swelling at the bite site, bronchospasm, and a decrease in blood pressure. To help, the bite site is washed with warm water and soap, treated with antiseptics. Ice or chilled objects are applied to the bite site. You need to drink a lot of water and take an antihistamine. If you like to relax in nature with an overnight stay, you need to be careful. The scolopendra can crawl into a sleeping bag or tent. The composition of the scolopendra venom includes substances that cause severe pain, swelling, and inflammation of tissues. The pain from a scolopendra bite can last from several hours to 2 days. Common symptoms include fever, weakness, dizziness, and nausea. The bite wound is best treated with ethyl alcohol or an alkaline solution of baking soda. The victim needs rest, plenty of fluids, and an antihistamine. The wound from the bite of the scolopendra is infected with pathogenic microorganisms and often becomes inflamed. When spending the night in nature, tightly close the entrance to the tent. Do not leave your things outside. A saltpeter can hide in them. The saltpeter has no poison, but there are decomposing remains of eaten insects on its jaws. Therefore, the bite of a saltpeter leads to infection of the wound, inflammation, and suppuration. When a saltbug bite occurs, it is necessary to wash the wound with clean water, disinfect the wound, and apply gel or powder with antibiotics to the bite site. Ticks can carry infectious diseases that are dangerous to humans. If you are bitten by a tick, you can pull it out with tweezers or thread, making a loop out of the thread. After removing the tick, it is necessary to disinfect the bite site with ethyl alcohol. If the proboscis of a tick has come off, it must be removed from the skin with a needle. To prevent the tick from biting, it is necessary to treat your clothes, especially the lower part of your trousers, with repellents. Another person can be bitten by wasps, bees, bumblebees, hornets, and other insects. In addition to swelling at the bite site, the following symptoms may appear: rash all over the body, fever, headache, nausea, vomiting, and convulsions. To help with the bite, first, you need to get the sting out of the person. You can put a cloth moistened with a solution of baking soda on the bite site. The use of antihistamines will reduce swelling. There are no sharks in the seas near Crimea. That's good. But this does not mean that the sea is completely safe. There are stingrays in the Crimean seas. If you accidentally step on it, it will hit you with a sharp, poisoned spike on its tail. After that, the following symptoms appear: pain along the injection site, paleness of the skin near the injection site, later redness and blueness, nausea, dizziness, chills, fever, weakness, drop in blood pressure, increase in heart rate, the appearance of a feeling of anxiety. Lymph nodes may also increase, sweating increases, vomiting and diarrhea may appear. To reduce the concentration of poison and ease the pain, the wound must be washed with a large amount of water. If there are thorn fragments left in the wound, they need to be removed. Then you need to apply an antiseptic bandage, immobilize the limb, and call an ambulance. Now we will talk about the principles of rational nutrition. That is, about the principles of nutrition of a healthy person. Compliance with these principles will help us maintain our health and avoid diseases related to nutrition. We are what we eat. Hippocrates said it, and he was telling the truth. According to statistics, about 70% of all diseases are related to nutrition, directly or indirectly. This is a classification of nutrition-related diseases. The first group is primary or exogenous alimentary diseases. This group of diseases is associated with an excess or lack of food components, its caloric content. These include hypo or hypervitaminosis, hypo or hypermicroelementosis, excessive or insufficient intake of calories. To prevent or cure diseases of this group, it is necessary to adjust the diet. The second group of diseases is secondary or endogenous alimentary diseases. In this situation, a person receives the necessary amount of nutrients and calories from food, but for some reason, these components of food are not absorbed by the body. This may occur due to endocrine or psychological problems. Surgical operations, for example, removal of part of the stomach. In this situation, the correction of nutrition is ineffective. The doctor needs to find the reason that prevents the assimilation of nutrition. The third group is diseases of multi-factoral etiology. The peculiarity of diseases of this group can be considered that food is not the only cause of these diseases, but only one of several risk factors. For example, diabetes mellitus. Excess carbohydrates in the diet is only one of the existing risk factors. Diabetes mellitus can be triggered by genetic predispositions, stress, toxic damage to the pancreas, and so on. The fourth group is diseases associated with the presence of harmful factors in food. This group of diseases include food poisoning, intestinal infections, and helminthiasis. The fifth group is food intolerance. A person may have an allergic reaction to any component of food, or a person may lack an enzyme necessary for digestion. As we have already said, there is a rational diet to preserve and strengthen health. This food is intended for healthy people. There are also preventive nutrition. This type of nutrition is intended for people who have a predisposition, the risk of diseases of multifactorial etiology. In this case, the correction of nutrition will allow a person to avoid atherosclerosis, diabetes mellitus, and hypertension. There are also preventive nutrition for the prevention of occupational diseases. This type of food is intended for people who work in harmful conditions. In this case, the food contains an increased amount of vitamins and adsorbents that bind toxic substances. For example, such adsorbents can be considered fiber or pectin substances contained in fruits. The fourth type of nutrition is dietary nutrition. This is the nutrition of sick people. designed to ensure that their recovery takes place as quickly as possible. The first principle of rational nutrition is a balance between spent and received energy. If we get fewer calories than we spend, the result will be protein to energy deficiency. If we get more calories than we spend, the result would be obesity. If a person has a problem with being overweight, the doctor can give him only two recommendations: to limit the caloric intake and increase energy consumption. Of course, obesity is not associated with endocrine or other pathology. Of course, if obesity is not associated with endocrine or other pathology. The second principle of rational nutrition is the correct ratio between the components of food. For example, the recommended ratio between proteins, fats, and carbohydrates in Russia is 1:1:4. In the Russian Federation, it is also recommended to maintain the ratio between plant and animal products, with a predominance of animal products, the balance between trace elements, and so on. The third principle of rational nutrition is the optimal diet. This means that it is recommended to eat 4 times a day. This corresponds to the rate of digestion of food in the gastrointestinal tract. It is also recommended to get the bulk of calories during the day. In the evening, it is advisable to stop eating 4 hours before bedtime. At night, the main energy consumer, muscles, does not work. Therefore, all the food eaten before going to bed is stored in reserve in the form of additional fat. In addition, eating before going to bed interferes with our sleep and disrupts our normal rest. The fourth principle of rational nutrition is good organoleptic properties of food. In other words, the food should have a good taste, smell, and attract attention to the table. While eating, doing other things such as watching TV or reading a book is not recommended. It prevents us from controlling the amounts we eat. Eating in front of the TV is the way to obesity. The fifth principle of rational nutrition is that harmful chemicals, microorganisms, radionuclides, and so on should be absent from food. Food should be safe. Food poisoning creates a lot of problems for us in the hot season. Food poisoning is not contagious. Diseases that are not transmitted from person to person directly, but only through food. Food poisoning of microbial etiology is divided into 2 groups: toxico-infectious and bacterial toxicosis. Bacteria that cause toxic infections have endotoxin inside the cell. They multiply in food and accumulate the toxin inside their cells. When bacteria enter the stomach, they die and the toxin is released. The incubation period, that's the time between eating and the onset of the disease, is very short, several hours. The disease is most often manifested by gastroenteritis. Symptoms are nausea, vomiting, diarrhea, and fever. Since bacteria die in the stomach, the antibiotics are not needed for treatment. Treatment is the removal of toxins from the body. To do this, the stomach is washed, the intestines are washed, and a person is given adsorbents with a lot of water to drink. To prevent toxic infections, it is necessary to store food properly in the refrigerator for a short time. Good heat treatment, such as frying or cooking, helps to kill bacteria. In the case of bacterial toxicosis, the microorganism produces an exotoxin located outside the cell, which accumulates in the products. For example, we can name Staphylococcus aureus. This microorganism is the only one that can survive in cakes. It can stay alive at a sugar concentration of up to 55%. Therefore, if someone felt the symptoms of poisoning after the cake, it can only be Staphylococcus. The manifestation of food poisoning with staphylococcal toxin is very similar to food toxicoinfection. Symptoms are nausea, vomiting, and diarrhea. But there is an additional symptom, which is muscle pain. Treatment is removal of toxins from the body, gastric lavage, intestinal lavage, adsorbents, and copious drinking. Botulism is a serious bacterial toxicosis that can lead to death. Clostridium, which causes this disease, is an anaerobe. That is, it is able to multiply and secrete a toxin without oxygen. Therefore, the toxin accumulates in the canned foods. The toxin damages the nuclei of cranial nerves. Damage to the optic nerve leads to impaired vision, a feeling of fog or spots in front of the eyes. Damage to the oculomotor nerve causes double vision, spontaneous lowering of the upper eyelid, and inability to focus vision. Damage to other nerves leads to impaired swallowing, lack of facial expressions as well. Vagus nerve paralysis leads to constipation. Botulism is the only food poisoning in which there is no diarrhea. If a person is not urgently injected with a serum that binds a toxin in the blood, this person is 50% likely to die from respiratory arrest. For the prevention of botulism, it is necessary to observe the rules for the manufacture of canned food. In the Russian Federation, botulism most often occurs after eating canned food made at home in violation of the rules of heat treatment. Also, the toxin can occur inside the home. Made sausages in dried fish. Poisoning with poisonous mushrooms. The most poisonous mushrooms in Russia are red fly agaric and pale toadstool. Red fly agaric is very noticeable. It is difficult to confuse it with edible mushrooms. The toxins of the red fly agaric affect the central nervous system, causing a condition similar to alcohol or drug intoxication. This is the reason for its use. Treatment is the use of atropine, which is an antagonist of mushrooms' toxins. Adsorbents, copious drinking, gastric and intestinal lavage are also used. Pale toadstool. It is most often collected by mistake, thinking that it is an edible mushroom. The toxins of the pale toadstool cause copious diarrhea, which leads to dehydration of the body and disruption of the central nervous system and cardiovascular system. The toxins of this fungus also destroys red blood cells, which leads to a decrease in hemoglobin in the blood and hypoxia. There is no specific antidote. Treatment, elimination of toxins. Prevention, you can't pick mushrooms if you don't know if they are edible or not. Mushrooms cannot always be clearly divided into edible and poisonous. There is a group of conditionally edible or conditionally poisonous mushrooms. These mushrooms that you see in the picture can be eaten after boiling in water. In this case, the organic acids contained inside the mushroom pass into the water and are removed. If this mushroom is fried, a person will get poisoning, accompanied by the destruction of red blood cells. Another interesting mushroom, which is still being treated for alcohol addiction in the villages of Russia. This mushroom is absolutely edible and does not cause any poisoning. But the composition of the mushroom contains a substance that prevents the breakdown of alcohol in the body. In combination with alcohol, this mushroom causes nausea, vomiting, dizziness, palpitations, salivation, abdominal pain. Dried and powdered mushrooms are added by wives to their husbands' food if they think their men drink too much alcohol. The purpose of this is to cause a negative attitude to alcohol in a person. There are too many poisonous plants to show them all. Poisoning with poisonous plants is a problem of childhood. In order for children not to get poisoned, parents, educators, or teachers should monitor and train them. In addition, poisonous plants should be destroyed on the territory of schools, kindergartens, or places where children walk. Poisoning with products that are sometimes or partially poisonous. Are potatoes edible? Of course, but if you store potatoes in a well-lit place, they will turn green. In the peel of green potatoes, a toxin is formed with an irritating and hemolytic, that is, destroying red blood cells, effect. The same can be said about the apricot. Some people like to break a stone inside an apricot and eat the kernel. But some varieties of apricot contain a toxic substance inside the stone, which disrupts the exchange of oxygen in the cells of the body. You can also get poisoned by heavy metal salts. A galvanized iron bucket is safe if you store water in it. But if you try to cook food in a galvanized bucket, then you will get poisoned with zinc salts. Zinc salts do not penetrate from the intestine into the blood, but have an irritating and ulcerating effect on the intestinal wall. Another example of poisoning with heavy metal salts is lead poisoning. Some people who do not have money for new dishes try to repair leaky dishes with lead soldering. In this case, lead salts get into the food. Lead salts easily penetrate from the intestine into the blood and damage the central and peripheral nervous systems. Poisoning with agrochemicals. Pesticides are used to kill insects and other pests. After using pesticides, it should take several days or weeks before the pesticide breaks down and it will be possible to harvest. If the farmer did not read the instructions that are in the package with pesticide and harvested too early, the pesticide does not have time to decompose and can cause poisoning in buyers. The clinical picture of poisoning will depend on the type of pesticide. For example, organophosphate pesticides block the nerve impulse at the synapse level. Prevention is the control of the use of pesticides and the control of residual amounts of pesticides in food products. Fertilizers are used to increase the productivity of plants. The greatest problem is the use of artificial fertilizers, which are also called chemical or mineral. In case of an overdose of fertilizers, an excess amount remains inside the vegetables and fruits and cause poisoning. You can also get poisoned with food additives. Food additives are potentially toxic substances that are used to change the properties of the product, to give the product an attractive color, taste, smell, or consistency. If they are used in minimal concentrations, they are relatively safe. If they are added to food more than the recommended amount, food poisoning is possible. The clinical manifestation of food poisoning will depend on the type of food additive used. Mycotoxicosis or poisoning by mold toxins. Most often, people think that by removing mold from the surface or cutting a thin layer of fruit peel, they have removed the danger. This is not the case. Toxins can penetrate deeply into the product. As you can see, the toxins of some types of mold causes very serious health problems. Seizures, damage to the central nervous system, decreased immunity, and cancers are possible. Gaf disease. This is a very rare type of food poisoning. It is only found in 2 countries of the world, in the Netherlands and in the Russian Federation. Sometimes a large amount of toxic algae appears in the water. These algae are toxic to humans, but not to fish. The fish feeds on these algae and toxins accumulate in the fish. This does not create any problems for the fish, but it creates serious health problems for the person who caught, cooked, and ate this fish. The toxin causes myoglobinuria in humans. The toxin destroys the muscles. The protein myoglobin of the muscles accumulates in the vessels of the kidneys, disrupting their work. This leads to acute renal failure. Exactly the same principle is used to poison the meat of wild quail. If this bird lives on a farm, the farmer controls the nutrition of the bird and its meat is completely safe. If the bird is wild and lives in the forest, it can eat poisonous berries, poisonous to humans but not to the birds. Therefore, there are cases of poisoning with wild quail meat among hunters in Crimea. Thank you for your attention and see you soon.